I go out to the community for a lot of outreach events to try to educate and also provide resources for the community. I also engage in a lot of community agency meetings so that I can better serve my community. I also try to build meaningful relationships with my clients in order to build trust and being able to eliminate any barriers. When I receive a referral for case management, I reach out to the family, introduce myself and a little bit about our program, and schedule an appointment with them. After our meeting, we try to create a plan with them to see how we can improve their situation. It brings me really great joy to bring out the highest potential of a person and helping to get them to a better situation. I have definitely seen an increase of community empowerment and resourcefulness. One family that I'm very proud of is actually a grandmother that is caring for two of her granddaughters. They were living in their car for a few months and had to leave a dangerous situation. When I started working with them, we did explore a lot of different resources, and we were very lucky to get into a housing program for them. Currently, they are living in their home and just growing, connecting to services in the community, such as counseling services and also accessing food banks and other resources that they didn't know of before. I would like our program to continue to be that safe haven for people to come and know that we're here in the community to help out if they're ever in a crisis, if they're ever in need, to connect to any resources. Also love when they come back and share with us their successes.
Here on Ontario Montclair School District, I help our community members access medical care. That could look like insurance enrollment for either Medi-Cal, Covered California, and empower them in gaining access to any type of medical resource that they may need or that their families might need. I, myself and my family, struggled with some of the same barriers in accessing healthcare and other community resources. So it's something that I'm passionate about because I know what it feels like. But it just feels really good to be able to empower our community and give them those tools to support themselves and their families. Some who have came with medical conditions that they were not being treated at the time that I first met with them, to then later having them come back and share that they are now getting care for their medical condition. Beyond just seeing the students get whatever support they need, whether it's for a medical condition or even something as simple as accessing glasses or dental care, you see the growth in the student. But then you also get to see at times when it's the parent who needs the medical support and care, you're able to see them now, because they're in better health, support their students, which then transfers into the student performing better in the classroom. You just see how something that to some may be so simple as medical care really trickles down to the whole family